Good morning and happy South Florida Saturday. Welcome once again to Limitless Health Horizons right here on Legends 100.3 FM. Mike McGann with you as I am every Saturday morning at this time. And with me, of course, my dear friend, my co-host of this program, and someone that we've been close for a lot of years, Andrea Albertini. Andrea, good morning.
Good morning and happy Saturday, everybody.
It's great to see you. And of course, this program is brought to you by Horizon Care Services, excellence in private duty home care. Andrea, the founder and the owner of Horizon Care Services. So no better authority on them and what they do so right than my friend Andrea Albertini. The website to learn more is horizoncareservices.com. Horizoncareservices.com. Just that simple. And the phone number is 561-776-7757. Now, we've talked a lot about what home care is, because a lot of people still are not entirely sure. But I'll tell you, sometimes the best way to talk about it is through a case study or someone saying thank you for the care that was provided.
Exactly.
Now, coming into the show today, it's a little bit different because we heard a song, and that song was by Four Aces featuring Al Alberts. Al Alberts, tremendous singer. I mean, really just an unbelievable harmonizer and so on.
Amazing.
And Andrea Albertini's father-in-law actually was Al Alberts. So we like to play that kind of as a tribute.
Yes.
And it's a beautiful piece, beautiful guy. And that also has a tie-in to someone that I know well. You listen to Legends, you know this guy well. And Andrea, you know him and his family. You want to talk music? Well, Dick Robinson, Society for the Preservation of the Great American Songbook, founder and owner of Legends Radio, who I believe had a conversation with you very recently.
Yes, actually, I was on the phone with him when I came in. It was really very special to hear from him because years ago, he used to spend a lot of time in Palm Beach. So
yes.
His wife happened to become needing my services, and I actually provide wonderful care for her. So today we were speaking about, my father-in-law, Al Alberts, with the Four Aces, and as well as, the show, Limitless Health Horizons. And we are almost 2 years. We're going to be 2 years.
Wow, we're 2 years old.
Almost 2 years old.
Unbelievable.
And he listened to the show, and Missy, his daughter, listened to the show. They're both on a call with me today. And I know, Dick, you're hearing me right now, and I am so grateful of the kind words that you said to me, and the appreciation that you guys do for me being taking care of people for so long, and my passion of taking care of people. So I appreciate all your kind words today. So it was very excited to hear from you.
Well, I do remember when that happened. I remember when Dick's wife had some care from Horizon, and I remember just how happy the family was with that.
Yes.
I know Dick did some commercials for you guys afterward.
Yes, he did.
Because he
did.
He was very impressed with it. But that's what you were able to do. I mean, you were able, through Horizon Care Services, to step in when someone needed you, to take the pressure off the family, to work with their recovery from a situation in their home. So they were on their territory. They were in their place where they are comfortable, the layout they know,
exactly,
the place they know. And that comfort level, I've always believed, is going to lead to better outcomes. And that is what Horizon Care Services is all about. And the breadth and the scope of what you offer right there in the home, it's amazing, Andrea. There's nobody that does it like you.
No, and last week we were talking about UTI.
Yeah, right? Oh, yes, yeah.
So
and my mom talking to the animals.
Poor girl. I'm sorry.
No, it's okay. But we used to laugh about it. Once the IV antibiotics would hit her, and the fever would clear, she would say, I was talking to the animals again, huh, Mike? And we would laugh, and then if it happened again, we'd know. But she had a great sense of humor about it. But, it's something that can have really severe ramifications.
Absolutely.
So I was always glad when she was able to joke about it because it meant she was okay.
But one of the things that a lot of people don't know is that if you do have a UTI, you don't have to go to the ER and sit there and do triage and wait in a waiting room for 45 minutes to an hour to 2 hours in pain.
And have to deal with Mike giving his mom wheelies in the wheelchair.
Exactly. You can actually call Horizon Care Services, and we can order the medication medication for you. We can have a nurse over there administering the medication for you. I mean, you can't get any better than that.
It would have been a game changer for my family because when my mom got UTIs, I'd be on my way to the radio station, or, my sister would be on her way to teach school. She's a teacher. My brother owns an internet business. It might have been, he was on his way in. He was the owner of that company, and we had to take mom to the hospital. One of us would always have to stop what we were doing when that happened. And we didn't mind. I mean, it was mom, right?
Sure.
But what a gift it would have been to have had home care. Just be able to come in, give her that test, run the IV antibiotics, and handle it right there.
Exactly.
Could have watched Magnum with her that night. She loved Magnum.
Oh, so cute.
Great stuff.
I love it.
Big crush on Tom Selleck. But, that was the thing.
So am I. I had a big crush on Tom Selleck.
I'm sure.
And actually, I was married before, and my ex-husband actually looked exactly like him.
I wonder why. But that's the thing is that, and that's the other thing about this, by the way. The care that you provide, it does make that huge difference. But the joke that you just made about things, right? You are a very human person. You're human. You understand humanity. You deal with people as human beings, not as numbers. You care for them like they are family. You care for the human being that's in front of you.
Oh, absolutely.
That's what you did for the owner of this radio station's wife. That's what you've done for so many people. That's what your caregivers did for you when you needed the help.
Oh, yes. That's for sure.
That's the thing is the breadth, everything is under your umbrella. There's not much you don't do through Horizon Care Services or the other businesses that you have when it comes to helping people in need, people who need that care. And, there are some stories where that care doesn't happen. And you were telling me before we went on the air, we ran out of time before you finished the story. So I want to hear the story about it. There was a patient discharge that you were starting to tell me about. And, it could have gone very badly.
Oh, yeah. So, so when you get discharged from the hospital or a skilled nursing facility that you're there inpatient for 30 days, right? Or 20 days, 30 days, whatever the case may be. So they discharge you home. Now, they don't know if you have food in the refrigerator. You come home with no medication. You come home with a prescription, really.
Right.
That you have to be responsible to fill that prescription, correct?
Yes.
So we have a transitional care program that we started to share with the hospitals and the skilled nursing facilities, that we actually have a caregiver picking you up, taking you home, making sure that you have food in a refrigerator, make sure that we drop the prescription off in a pharmacy, pick up the prescription for you. If you have a pet that maybe could be, in boarding because you were in a hospital, you didn't have anybody to take care of it. The caregiver go pick your pet up, making sure that your linens are clean, make sure your house is tidy for you to come home. And, and if you don't want the caregiver to stay there for more than 6 hours, fine, she leaves. If you want her to stay for a few days until you get better, until you get on your feet again, we could do that. Now, what happened last week?
Yes.
We were not involved.
Sure.
So remember I talked about the difference between Medicare agency and private duty, right?
Yes.
So Horizon is a private duty custodial home care, correct?
Yes. It is a private duty custodial home care.
Right. And skill as well, but we're more in a continuing care.
Sure.
Okay?
It's that continuity that comes with continuing care. Again, better outcomes.
Exactly.
Yeah.
So the Medicare agencies are basically, it's an intermittent. We call intermittent. Yeah. They come in 48 hours after the patient gets discharged from the hospital, and then, but in 48 hours, a lot of things can happen, correct?
Oh boy, can they ever.
Exactly. So I have a friend of mine who actually works for a Medicare home health agency.
Okay.
And she picked up on that this patient actually came home with no medication, by herself, and no medication.
No medication?
No.
Like nothing for any pain she may have been, no antibiotics, nothing at all?
No. This is Friday afternoon, right?
Well, yeah, okay, good luck getting somebody on the phone or getting that done.
Right. So most likely Friday afternoon is, we call them, they've been dumped.
Yeah,
right?
They try to discharge them early so that they don't have
to, and you can't get a hold of anybody. You can always get a hold of us. I can promise you that.
Boy, is that, again, very true. 561-776-7757. That's the number for Horizon Care Services, and somebody's going to answer.
Exactly. And remember, we cover from Broward County, Hollywood, all the way to Port St. Lucie. But so this patient comes home. So this friend of mine that works for a Medicare agency, she called my mobile physician practice, and she said, "This frantic. Now she's on a cruise. She's on the cruise. She checks her email, finds out this patient went home with no medication.
Wow.
She called my office, my mobile physician office. We dispatched my nurse practitioner on that Saturday to go and make sure that she saw the patient, made sure the patient was okay. We got some private duty hourly care for the patient.
There you go.
And we got her medication.
And I'm sure, you get the medication, which obviously is step one.
Yeah.
But then, there's sorting medication. There's setting it up for so many people who need it. I've told this story a lot of times on this very program about my mother's medication, and it was 2 of this one day, and then every Thursday it was this, and there were so many pills. And my father was always doing his best. The guy was an aerospace engineer, a bright guy, but he was older, and it would take hours for him on a Sunday night to set up my mom's medication. And I tried to help. He said, "Nope, this is my job."
Oh,
and I know it was stressful and challenging for him. And he did it because he loved my mom. But, having someone there to just sort it. When I took it over, I got it done in 10 minutes, and Dad was grateful. But, having somebody there who can understand, knows the right questions to ask, knows also, wait a minute, this medication, it might interact with this one. That's another thing, the knowledge, because you have one person in one place.
Yeah. And not only that, but discharge orders. What is the discharge orders?
And how often do you read them, really?
When do you have to follow up with your physician? Who's your primary care physician? Do you have a primary care physician?
Does it say reach out to your primary?
Right.
Does it say do this?
Right. That's what I'm saying. So there's a lot more than just, I don't have my medication. What do I need to do from now on? Who do I need to call to follow up? You know what I mean?
Yeah, that's so true.
So it's very important. So with our support at home, we actually make sure, so we called the patient yesterday. My office called the patient yesterday and asked, can we make an appointment with your primary care physician for you to follow up with your primary care physician? So we did. So, but if we haven't done that, you home rehabbing, are you going to think about reading that discharge orders?
Absolutely not.
Absolutely not.
And if you're someone who's older, if you're someone who may not see as well, someone who also doesn't want to bother, there's a million reasons why people don't.
But some people don't even know what a discharge order is.
That's the thing. What are these papers?
They just bring it
They
home.
file them or toss them, or this is what I needed to get out of the hospital, and then you're done.
Yeah.
And that's a common one, is you sign and that's all you need. Why even look at it again? Yeah. But there can be instructions that can literally be life or death there.
Yeah. There is some case managers who are very thorough, right?
Sure.
That explains everything to the client, this is what you need to do, and so on and so on. But there's some of them who are not. And especially that if you are overnight on an ER for observation, if you're only there for observation, most of the time you have just a charge nurse discharging.
That's right.
You don't have a case manager.
No.
So
it's, you lose the details. The devil's in the details, right? Someone that can follow up on all those details. That's really what it takes. Someone who knows what they're doing. Because my dad, again, very detail-oriented guy. But if he didn't know what he was looking for, he was an engineer, not a medical professional. So he did the best he could. But it took several pairs of eyes. If you can have just the pair of eyes that is that nurse practitioner, that person who's helping with the transition, that person that Horizon Care Services provides, to dot the I's, to cross the T's, and to make sure that you don't have to worry about it, you're going to be getting way better, way faster.
It's amazing.
And you're getting the right medications too.
Absolutely. Absolutely. It is so important, and a lot of people don't realize that, Yeah. And then there was another thing that happened that I wanted to mention. How important, I know we're going from one thing to another, but I don't want to forget. There was something happened this week that kind of, I never heard of that. I heard that before, but I haven't heard that for a while. So there was a client of ours that they've been together for 32 years. They had a child. She's 24, but they never been married.
Okay.
So now all of a sudden he passed away.
Oh,
There's
boy.
no trust.
I was just going to
State of
say,
Florida.
the estate would be a nightmare.
There's no trust. There's no will. There is no, there's nothing. Absolutely nothing. And he actually have children from another marriage, right? So I don't know the law.
What a web.
Right. I don't know what the law entails right now under this situation at all, because I haven't heard of that in a long time. That's why I haven't spoke about this in our radio show, Mike. But again, please, 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 no matter how old you are, you gotta have your ducks in order, because it's just, you never know.
Well, you know a guy.
I know a guy.
You know the guy.
I know the guy.
He's a good friend.
James Jaffe.
James
is
Jaffe.
one of favorite trust attorney, elder law attorney.
Oh, he's amazing.
He's amazing.
He's
his practice. I actually went to visit him in his
did
office. Yeah.
He's one of my
Very
favorite
nice.
people because, he is, I'm thinking about this because he reminds me a lot of you insofar as how he approaches his business.
Yes.
He approaches it with heart.
Yes, he
It's
does.
what is right for this human being who needs me.
Exactly.
James is all heart. Hi, Ann. You're all heart too. James' fiance.
Yes.
I love her. She's amazing.
I love her. She's amazing.
They're a
She's
great
an
couple.
amazing singer too.
Amazing. Well, I think we told the story. They got engaged where you are sitting. They literally got engaged live on my radio show on a Friday afternoon. And they're tremendous people. But James is a tremendous estate lawyer.
Yes,
he knows the questions to ask when you don't even know there are questions.
Exactly.
You know what I mean?
Exactly.
But he falls under your umbrella. Like James is a friend of yours. He's someone that you refer business to.
Absolutely.
And you don't get paid for that, but you do it because it's the right thing to do for the people who need it.
Exactly.
Horizon Care Services. It's what you do, Andrea, whether it's the home care that is your forte, getting that continuing care right in the home, the transition, having that person there in the home to make sure that they are readapting properly, to make sure they're finding their way, to make sure that they're walking steadily again and that their medication is ready and that all of those activities of daily living are covered. That's what you do through Horizon Care Services. But through your other businesses, like, for instance, the concierge doctor, like James Jaffe, like the compounding pharmacy that we love, you bring the right people in, the right team that it takes for every aspect of a care journey.
And we had Dr. Moenda last week.
What a
on the
great
show.
guy, man.
What an amazing guy.
Same
amazing
story as
soul.
you and James.
Exactly.
All heart.
And all amazing physician.
Yeah, really. You can tell.
And even though we have nurse practitioner that,
Sure.
that does nursing visits, but we also work with Dr. Moenda because he's an MD. He's a hospitalist.
Yeah.
And he is just most beautiful soul in the world.
He's a very kind guy. I
Very
always love
kind.
having him here. Like you can
very
feel the energy
Yes.
in the room.
Yeah.
He's a soother.
Yes, he is.
And you need that
He is.
because
Yes.
he's a physician. He knows his medicine, but his bedside manner
Oh my God.
is
Bedside man is amazing.
It's amazing.
Yes.
You get that. You get you have James. You have the other great people that we work with, you work with, and we talk to all the time. And it's a balanced picture.
Yes.
There's not much that is not covered. And, these are painful decisions. These are things that it's hard to give some of these things up. It's hard to trust somebody come into your home. It's hard to trust somebody and say, will you look at my estate? Or there's a problem here or a problem here. You're trusting people. You have a trustworthy team at Horizon and the other people that you have you've put together around
Absolutely.
it. HorizonCareServices.com is the website. HorizonCareServices.com. You can also call 561-776-7757 to learn more about those services. 561-776-7757. For me, it's just the best kind of outcomes. I like being home. You know me, I like being out and about, but I like being home. That's where I'm comfortable. If I'm trying to unwind, that's where I am. If I'm not feeling well, I want to be home where I can, take a breath and be in my surroundings. And I think that's the case so often when it comes to needing care in general.
It does, because for us, you can have X-ray at home, you can have an EKG at home, you can have the lab comes in to draw you.
The lab literally shows up.
Exactly.
It's amazing.
Oh, yeah.
It's amazing.
It's amazing. Your medication can be delivered to you. Things are just so easy with us, with our care. Why are you going to drive yourself to the ER? Why are you going to drive yourself to an urgent care center? If you can just have somebody come into your house, it's a no-brainer. And especially, do you want to take your mom and your dad to the ER? Really?
No.
There's so much germs, there's so much going on. Unless it's a life and death situation, I wouldn't want to go to the hospital. I would rather, be cared for in my house.
Be cared for at home.
Really?
Now, that brings me to another topic, actually.
Yeah.
And this is a hard one to talk about. For those of us who have dealt with it, and I think all of us have been touched with it some way or another, dementia, Alzheimer's.
Yeah.
It's tragic enough when it hits people later in life, but it doesn't always wait.
No, it doesn't.
And early onset dementia, I mean, the numbers are growing.
It's growing tremendously, yes.
I saw a gentleman years ago when my mother-in-law for my second marriage was in an assisted living, and we went to visit, and there was this guy there that was younger that I always saw, and I figured he was working, or maybe he was the son. And it turns out he had early onset, and his sister would visit him. And it was heartbreaking to see, because you could see that he still knew enough about what had been taken from him. And his sister was probably younger. I think she was a little younger than him. And she was walking in places there. And she took wonderful care of him. But it was devastating to see. And the thing is, though, there's still a benefit often to being in the home for someone who has dementia and early onset. And there's a pretty strong case to be made that assisted living, is it the right thing, or is home care better? And it's a very interesting discussion to have, I think.
It is. For a lot of people, the best way is to stay home, right?
Yeah.
However, it does get to a certain point for
Sure.
certain people.
It's going to hit a critical mass for a
that
lot of people, yeah.
No one can handle anymore.
Right,
I don't
sure.
care how wonderful your caregiver is. I don't care if you have 2 different caregivers in a home. It is going to get to the point that, some people get combative, right?
Well, the disease takes over. It's not that person
Exactly.
anymore in
No,
there.
it's not.
It's not, and it's hard to make that break. It's hard not to take it personally. It's hard not to look and just feel heartbreak every single time.
Exactly.
And yeah, there does come a time when they need that kind of care. But before that, up to the time that happens, being home can be a very good option.
It is very good. It actually delay the process.
I'm not surprised to hear that, because
Yes.
if you're taking the stress away,
Yes.
the sense of comfort being at home, a familiar areas, feeling like you know where you are, even if you're wrong, if you think it, and that happens a lot. You get people that
does.
believe it's the house that they built, even if it's not.
Exactly. It's their belongings.
It's
their
their
furniture.
it's their place.
It's their place.
Yeah.
So keep them at home if you can afford it, as long as you want, as long as you need to. But I do have clients that stays until they pass,
Sure,
right?
of course.
But some of them gets irritable,
Oh, yeah, of course.
uncontrollable. They have sundown, severe sundown.
Oh,
so
yeah.
some of them do need to be going in.
Sure.
But have one of my nurses navigator do an evaluation. Let us take you to the best neurologist in town, Dr. Winner, which
Oh,
I had
the
him
guy's
mention.
awesome.
He's amazing. In Boca, we have Dr. Banchak, who's amazing. And her daughter actually is Tara Becker,
Yep.
which is specialized in seizures and things
Yes.
like that also. But have mom and dad be evaluated first. Don't jump in to say, I'm going to put my mom in a facility. Listen, I do senior placement. I can help you anytime you want.
Elder Care Finders,
Elder
that's
Care
the name
Finders,
of it.
which
Yep.
is my other company
Another
that
company.
I have that does senior placement. But please do an evaluation first.
You may find, when my grandmother had dementia, she passed away in my family home. And my mom and my dad were still able to take care of her. And they had some people that came in to help sometimes. But my grandmother was pretty comfortable right up till the very end. Now, it stressed her out when my mom took her by a drive by the ocean once without thinking. And she said, when did Denver get so big? And it was, okay, maybe it's better not to do like outings like that. But in the home, because there were antiques that she had and given to my mom, it was her place.
Yes.
She knew it there.
So important.
She sometimes thought the train was coming, but it didn't matter because it was a routine she felt she knew. She was almost never agitated because she didn't always remember who my mom and dad were, but she knew them and loved them.
Yes.
She knew if I came to visit, she knew me and loved me. The caregivers that did come, she knew that they were familiar and she knew them, but she was on her turf. And her last years, even in the grip of dementia, were as peaceful and fulfilled as I think they could possibly have been. And I'm thinking now, if we had a full-time caregiver there who could have taken some of that weight off of my mom and dad, but also become even more familiar to my grandmother, and then they might have thought she was family.
Sure.
I think that she would have had even more of that joy, even more of that sense of I'm with my family in my place.
Yes.
And if it's appropriate, I don't think there's anything better.
No, I agree with you. It's better for many people.
Yeah.
But like I said, it does get to a point that
It's going to at some point, but up until then, that is something that Horizon can help with.
yes.
That's just one of those many, many things. Think of things we've talked about today. We've talked about a state, okay? We've talked about a neurologist. We've talked about a pharmacy. We have talked about a physician that will come right out to your home. We've talked about somebody that can help with dementia, transitions, and all of it falls under Horizon Care Services. It falls under what you do.
Exactly.
Right there in the home. That's a legacy. And that is why you do it the way you do it, Andrea. That's what Horizon Care Services is all about. I remember, we've been doing the show about 2 years, and I remember about 2 months in, I said, it hit me, Andrea. Your key defining characteristic, your big word is advocate.
Yes. Oh, absolutely.
Everything
we
you do.
fight for everybody. We fight
Everything
for the
you
rights
do.
of everybody.
You fight for the rights, you fight for the care, you place the right people, you make the right recommendations, you take the right care of the human beings that you're there to take care of.
Yes.
And you use your own services when they were necessary for you. When your husband was having issues, and you used Horizon yourself.
Yes, I did.
And that says a lot for it.
Oh, yeah.
That really is the bottom line. There's care, there's heart, there is living as fulfilled a life as possible with whatever your case may be if you need care through Horizon. They're going to have the right people, the right connections, the right care for you. It's just that simple. You cover everything.
Everything, whatever you need.
Learn more about it. It's amazing to me because the time really does fly by here.
I know, right?
It's incredible.
I know.
But Horizon Care Services is the place to look. Excellence in private duty home care. And the mobile physician, horizonmobilephysician.com, eldercarefinders.com. Those are separate companies of yours. But you can find all of it and learn more through horizoncareservices.com, horizoncareservices.com, or by calling 561-776-7757. There are still people who think to themselves, and I understand it, well, mom's having a hard time, it's time to put her in a home. It doesn't have to be that way.
No, it doesn't.
Stay in that home. That may be the right option with the right care, and the right care is Horizon Care Services, because that's the way Andrea designed it over 20 years ago, and you're still rolling.
Yep.
Bigger and better than
Love
ever.
it.
And continuing to expand and find better products, better services, and better people to work with. It's what it's all about. That's Andrea's driving force, that advocacy and that care and excellence in home care. It's what she does. And if you need that help for a loved one, a parent, a spouse, a sibling, a child even, if there was something, it could be anybody.
Children too.
Yeah, if there's something, well, I know that one, so we'll have that discussion. But learn more about it. The help is there, and it's the best help possible through Horizon Care Services. Andrea makes sure of that, and she's the founder and the owner, so you can take it to the bank. 561-776-7757. They're going to answer the phone. 561-776-7757 and horizoncareservices.com. Andrea, it's always wonderful to see you, my friend, and talk about really the wonderful things that you do and the great options that are out there here on Limitless Health Horizons.
I do enjoy our time together, so thank you very much for the listeners and the viewers. We appreciate you.
We do appreciate you, Andrew. We appreciate you. HorizonCareServices.com. Limitless Health Horizons. Lots more coming next week at the same time.